Two of the most devastating words a woman can hear: breast cancer. Some women believe that it's best to have a healthy breast removed to prevent it from spreading. Joining us is medical contributor Dr. Yvette David. Yvette, let me ask you.
Fred.
Hi, Yvette. Do you think a woman should have a healthy breast removed to keep cancer from spreading?
I really don't, Fred. I think, the practice of medicine is based on clinical trials from the United States, from around the world, and that's how we mold the way we practice. That has been the case with the BRCA1 gene and the BRCA2, which are the mutations in genes that cause an increased risk of breast cancer in some people. But that makes up about 5 to 10% of the people with breast cancer. And to say that blanket statement for all people with breast cancer, we have not shown any data to support that that's going to change overall survival. And that's really what our goal is. So I don't agree with that personally.
I know screening is very important. How do doctors go about doing that?
I'm glad you asked. That's a really important thing when you're deciding. When you make this decision, it's such an emotional decision that when you're hit with this kind of news, and you really want to make an informed decision. So you need to weigh all the pros and cons. Normally, screening is going to be something like a ultrasound or a mammogram, which, of course, in a person with breast cancer is going to be done more often, especially in the first few years, along with breast exams. If you choose to have a bilateral mastectomies, you are not going to be able to have an ultrasound or a mammogram. You still could have cells left in with breast tissue, and you still are at risk of breast cancer, even if it's much lower. It's not zero. I don't want people to have a false sense of security. If they do the screening, they're going to need to get a CAT scan or an MRI, which are going to be more invasive in the terms of more, dye and radiation to you, more costly. So it's really something you have to really measure the pros and cons for.
All right, Yvette, I want to ask you about this because we just got our notice here at NBC. Time to sign up for your flu shot. Now, when I hear someone has the swine flu, my first thought is, oh, that's fatal. Last year, that was the concern, but this year it's different, right?
Absolutely. Right now, we are giving the seasonal flu shots. That's hoping to improve for the flu November to April. The swine flu was supposed to be out in the next couple of weeks. I heard today that the first shipments have already started. The swine flu is usually a very mild disease. It's the 2009 H1N1. It sounds like you're getting a new car, but you're just getting a cold, basically. But the thing is, it's usually mild. So you should not panic. No one should panic, but they should take care of themselves. And certain groups of people are recommended as the first line of people that should be getting vaccinated. And if you'd like, I can mention those people to you.
Please do. Yeah, please do.
Pregnant women. Pregnant women are worried. I've heard a lot of people talking, well, it's new. I don't want to put a new shot in me. It's not new. It's made from the same companies that they make the flu shot. It's made with the same ingredients that they make the flu shot. So definitely pregnant women should get the swine flu shot at any stage of pregnancy because they are at high risk of complications. People from ages 6 months to 24 years old are also in that group. People that are healthcare providers. I know, Fred, that means that you don't have to get it, right? You just hit 25.
Yeah, I was going to say, thanks, Yvette.
Unfortunately, healthcare providers over 24, but again, applies to me. Anyone with a healthcare provider should have it. People that are over 24 years old but have chronic illnesses, anywhere from lung, diabetes, neurologic, sickle cell anemia, chronic diseases, you're first in line to get it.
Dr. Yvette David, nice job tonight. Thanks for the information. We appreciate it. We'll talk to you again soon.
Thank you. Have a great night.
You too. Okay.
Bye.